Dr. Chawla, welcome to the health side. So
Hello.
straight away, my first question to you is कि a lot of confusion has been created about monkeypox virus. So what is monkeypox virus and what is the new strain that everybody is talking about?
Look, I'll answer this question very clearly in the sense because people are already quite unhappy and tired of COVID-19 or Corona. It is continuing for last 2.5 years. Everyone is fed up now is a new disease, monkeypox. Monkeypox is a zoonotic disease. That means earlier it used to occur in animals. Now it has crossed over to human beings. And till now in India we have hardly 10 cases, which is not too many in a population of 138 crores. Not forgetting, in Western Europe, there are more than 17 to 18,000 cases all across the world. So we are quite fearful, can it spread in India? So my first answer is it cannot spread the way Corona is spreading. It can spread only in some risk category patients, patients who have come from abroad, who have a history of having come from any foreign nation, who have a history of working with animals, who are working in some zoo, who are working in some leather products, or some drugs which are extracted from animals. All those people are at risk. Till now, as far as the new variant goes, the new variant exists, but our knowledge about this is quite less. But in this particular disease, apart from fever which continues for 3, 4, 5 days, we have pox. Pox means small collection of fluid in the skin all across the body. So that is what is the characteristic of monkeypox. It resembles smallpox, or as we used to call it, Badi Mata, say 4 decades back, or chickenpox, as it occurs in children even now also, it is called Choti Mata. So it belongs to that family of diseases. But at present, we have to be, since WHO has declared it to be a public health emergency, so we have to be careful because India is a very big nation. We have lots of people, villages, small towns, big towns, cities, big cities. So we have to be careful about all the members of Indian Medical Association and other doctors have to be quite suspicious to suspect diseases, because for first 3-4 days you cannot know whether it is monkeypox or it is some other disease.
If we compare it from the cases and the symptoms and talking about the new variant, how are the symptoms different from each other?
Frankly speaking, there is hardly much difference. The difference is only in the identification of the virus. This particular virus has been identified in India in Pune Institute of Virology, and soon we shall be having a kit also to diagnose it. Soon we will be having perhaps a vaccine also, but it will take some time.
Okay, doctor. And doctor, what about the treatment? How to treat monkeypox?
Listen to, it is a self-limiting disease, but till now all the 10 cases which have been suspected or diagnosed, they have been kept in isolation in various hospitals. For example, Delhi, it is in LNJP hospital in Delhi. So 4 cases in Delhi, few in Himachal Pradesh, few in Haryana. So that, and 4-5 cases in Kerala. So till now, the treatments are essentially symptomatic. That means we are not using any antiviral drug for it till now, because the disease tends to go off its own, but it takes minimum 3 weeks it to be declared a normal disease. And since not many deaths have occurred outside of Africa, but yes, one suspected death in Kerala did occur. So that is what has raised all the alarm. So in the days and weeks to come, we shall be perhaps more knowing more about this disease. Since Corona also is occurring alongside, so our attention is divided between these two, but we have to be very, very careful.
Okay, doctor. Doctor, what are the safety measures that one need to follow to prevent monkeypox?
Again, the same thing as I already said, it cannot spread in the ordinary people who are not in contact with any animals or people who have contracted monkeypox.
So it cannot be easily transmitted.
It can be transmitted, but if you happen to meet a patient who has monkeypox, it can spread by airborne route also, it can spread by skin to skin route also, it can spread by sexual route also. So we have to be quite careful, and since the symptoms in the beginning 4-5 days are the same, patient gets the fever, same sore throat, same cough and something. It is only on the 4th-5th day when we get some skin lesions, then we start suspecting, and then we can diagnose it by a blood test.
Okay, doctor, thank you so much for all the information you have given to us about monkeypox.
Yeah.